Can I first have you state your name and your area of profession or specialty?
I'm Iyabo Bukaj, physician, internal medicine.
Perfect. All right, so my first question for you is there a difference between the terms health, illness and sickness, or disease?
Yeah, I think there are major differences between all those terms. But I think really it's really perception from the perspective of the healthcare profession and patients. When people think about health, it could be poor health or good health. When people think about illness, sickness, or disease, I think they think interchangeably of the same thing. It connotes something is wrong and something needs to be fixed.
Okay, so are you saying that illness is the same as a disease?
I don't think illness is the same as a disease. Disease, I think, is objective.
Okay.
Whereas illness can be very, very subjective.
Okay. And as healthcare providers, should we differentiate between diseases and illnesses, like in our charting or the way we label things?
Gosh, from a very personal perspective, I'm one to have, to think of, I tend to like one definition to describe one thing so that there isn't confusion amongst patients. I think having all those different terms just confuses patients.
So you prefer one term?
One term, yeah.
So in that case, would you put like a mental health disease or illness under the same thing as like colorblindness?
Not necessarily. I wouldn't necessarily. That's a good question. I don't consider colorblindness, disease. I consider it gosh, I don't know what I consider it.
A genetic difference or just something?
Yeah. When I think about disease, I think about an ailment that requires intervention at some point in somebody's life. When I think of colorblindness, I think of, a medical or historical piece of information that can help you, but doesn't necessarily connote disease. So I wouldn't label it a disease.
Okay,
Yeah.
good. Changing subjects, there's a new push for personal medical records.
Mm-hmm.
What are your opinions on personal medical records?
I'm all for personal medical records.
And for patients having access to them?
To a certain extent, yes. Patients to have access to them after they've been reviewed and edited by the provider or by the provider, whether it's a nurse, doctor, whomever. I think it empowers patients, and I think it makes them more involved in their own care.
Okay. And so do you think in turn this could improve health care? Or the quality of health care the patient receives?
I think it has the potential to improve healthcare, and I think it also has the potential to improve the quality of care. But then again, I think it has the potential to worsen quality of care. I think it very much depends on what we're going to do with the records and what we want our patients to do with those records.
Okay.
And how to use them, how to use the information within those records.
So between facilities, for example, if a patient could bring, their personal health record on a zip drive or a CD or have access to it via the internet, do you think that could improve healthcare?
Oh, most definitely. I think the VA is a classic example. No matter where you go in the world, if you have access to the internet, you have access to patient records. I think it speeds things up. I think it prevents duplication, I think it prevents excessive spending on doing unnecessary tests. I think everyone's on board with the patient with one diagnosis as opposed to, different diagnoses, different institutions without access to records. It makes life a hell of a lot easier. And I've had experience in this system and in, multiple systems that don't have, don't have access to electronic records.
And do you find yourself repeating tests? Or
right, because or they all have access to records, but they're not interoperable. You can't, you could be at Swedish and you can't access the records at Highline or.
Okay. Now, do you think when patients have record or access to these personal records, should they be able to edit them at all? Like if things change, if allergies change, should they be able to add to their records or take away from?
I think with patients having personal medical records, I think we have to be very, very careful, because I do not think patients should be able to edit their records, but I think they should be free to add, whatever they think is important to them from a health perspective to a part of the record that is editable. And I think a part of the record should not be editable, much like, I guess when you go and get your car fixed, you don't take the note from the mechanic and start changing things that he did, or,
so there should be like a separate section where they could add their own notes.
Right, definitely, where they could flag those notes and have their providers see those notes so that they can continue to communicate, and so they still feel like they're a part of their own health care.
All right, perfect. Thank you.
Okay.